I'm focused right now for the soft tissue pathologies, and want to point a little bit on sports medicine because I have many patients in my office are sport guys. They need the treatment. The question for sure, trauma or overuse. The question is acute phase or chronic cases. As I mentioned before, if you have very, very high active athletes, they have to back for the track and field activities immediately. They cannot rest for a couple of weeks. You cannot put them cast on it for 3 months, say, will be healed in the future, but they're gone. They never come back to your office. I use the Shockwave treatment with our knowledge we have right now as a first-line option because it's safer than any NSAID. It's better and safer than any injection, a cortisone injection. And you can use it sometimes as an additional tool to your normally used treatment cycle. If you have for sure, everybody has his own treatment modalities to treat and deal with your athletes. Don't change the protocol, but put the Shockwave treatment as a tool, as an additional tool for your cases, and offer them the treatment as a first-line option. I do it in my office as well. I don't wait for 6 months or 6 weeks. Wait for the chronicity. I treat the patient as fast as I can. The problem with the sports guys came in your office. They are pretty intolerant to any explanation. They stupid, mostly. They want to be back up. When they visit my office, 1 hour later, I can see them just training, exercising with the same level. Forgetting everything. So the Shockwave treatment is the good thing of Shockwave treatment is you can activate the biology without the mental collaboration of your clients. So this it works, and this is a good thing. But I try to bring the patients back to their activity with a modified modality, and I try to explain to the patient what they have to keep them as a good client in my office. This is a picture. If you Google as a client, if you're a sport guy and you have a shoulder pathology with the tendon pathology, and you work as a baseball player, or it's baseball, sport, yeah. And you use handball in Germany or basketball. The client's looking for a good treatment option. If you Google shoulder pathology treatment, a lot of stuff, you can find millions of hits easily. And if the sports guys is reading all these advertisement and papers, he will have 10 years and the disease is gone without any treatment. The difficulty is to find out the right technique. And the difficulty is to find a good technique from all of these options you have. And that's the reason why now we have the studies available showing that Shockwave treatment, it's real reality, and all the advertisings are really confirmed by these clinical studies. Overuse, it's frustrating for both. It's frustrating for the sports guys, and also for me it's frustrating. You have a client who has very low compliance. They still come back every month or every week or every day in your office, saying it has not changed anything, I still have the pain. If you treat these tendinopathies non-surgically, you have a long period for the recovery. You have a high frequency of relapses, sometimes patient with incomplete pain relief, and you have to work on the training conditions as well, not deal with the treatment itself. Unhappy patient, for sure, they still have the pain. They cannot understand why they have pain. Just 2 hours after treatment, the pain must gone. It's not possible to make it. And if keep the patient informed, then everything is fine. For example, for the tennis elbow, it's common to see in many sports guys. We know there's many options. Finally, you have the surgical options. But once you have performed surgery in these cases, they are off for at least 6 weeks or 8 weeks to bring them back. And if they're off within the season for 6 or 8 weeks, it's pretty hard to bring them back as a team. And even if you have a good surgery, some cases still have pain. They still have more pain after surgery. And what's to do then? It's pretty hard to answer. Shockwave treatment is less effective if a patient has get surgery before, if they have all scars in the lateral epicondylitis. For sure, you have to have a post-op treatment protocol independent which kind of surgery procedure you're doing. And you have a certain numbers, they have complications. It means persistent pain, scarring after surgery, limited range of motion, less of muscle activities, and joint perception. Looking for the evidence, is 4 out of 100 a year they have significant pain, and 7 out of 7.4% in their life will have this lateral epicondylitis pain. Options for surgery. This is a picture from surgery. For sure, you can detach the extensor insertion area from the lateral epicondyle. Less or more, you can make denervations of the periosteum around the insertion area. There's several techniques described, but all these techniques need a certain post-op protocol, splint or cast, or at least rehab for a couple of weeks after surgery. Still unsatisfied. So in Kiel, we have the Champions League winner for the handball in Europe, and I have these patients, they still have pain when they throw the ball, they cannot catch a ball, and surgery is no option for these cases, for sure. They accept more intake of NSAIDs every day, every 6 hours they take NSAIDs to perform training exercise and playing. And the question is, Shockwave is a good answer to deal with these patients? I think finally it is. It's an excellent option. It's not a solution for all your clients. The Shockwave treatment can be as good as the indication is and as good the compliance by the patient is. And there's a good study performed by Ludger Gerdesmyer and John Ferrier from Georgetown University and from Mainz. It's a prospective controlled trial in 2 centers. They're dealing with lateral epicondylitis and Shockwave treatment. They have enrolled 111 patients, performing low energetic treatments in 3 treatment interval. And you see that they all have decreased in pain, published by Petroni in JBGS. Ludger Gerdesmyer